So by way of background, why I selected this paper is because I work very closely with surgeons, oftentimes sending cases to get exploratories, or I deal with regurgitation, vomiting after the surgery. And so I was very interested when I saw this paper. So the objectives of this study were to determine the incidence of postoperative regurgitation and vomiting in dogs during the years of 2000 and 2012. And once the incidence was determined, then to also look at the risk factors that were associated with postoperative regurgitation and vomiting. So this was a retrospective study. When you say 2000 to 2012, it actually was not 12 years of cases. It was actually 3 months, the first 3 months of 2000 and the first 3 months of 2012. So 6 months of data. These were all non-elective surgical referrals. They included orthopedic, neurologic, and soft tissue cases, and these were also further subdivided. So soft tissue cases were further subdivided, for example, into GI surgeries or thoracic surgeries, et cetera. They collected quite a lot of data. So they looked at signalment, body condition score, emergency status, the food withholding status, history of vomiting or regurgitation prior to the anesthetic, history of diabetes mellitus or hypothyroidism, the preoperative PCV and total protein, the American Society of Anesthesiologists score, the anesthetic protocol, any current medications that the patient might have been on, the procedure type and duration, and then of course the endpoint, whether there was vomiting or regurgitation within 24 hours of recovery. So lots and lots of data, and actually a large case study here. 244 dogs were included in the study, and basically they included every dog that had surgery at their institution during that period of time. So there was really no exclusions unless you were just referred there and then didn't get a surgery. So if you got a surgery, you were included in the study. Overall, the postoperative regurgitation and vomiting incidence was 12%, so 30 dogs out of the 244. There were no significant differences between 2000 and 2012 as far as the overall incidence. However, as you can see, the incidence was higher in 2012, and the incidence of regurgitation was also higher in 2012. So I've written out the risk factors that were reported in the study from highest to lowest, but I did want to talk about their statistics just a little bit. People may not be very familiar with what an odds ratio is, and I was hoping the author would be here because even though I understand it, it's hard for me to explain it, especially without kind of the ability to do a diagram. But if you think about exposure and outcome and you plot those into a box that's divided into 4 squares, and the top 2 squares would be A and B, the bottom 2 squares being C and D. So you get a plus, plus, a plus, minus, and a minus, minus. So you put the patients that are exposed to GI surgery and also have the vomiting and regurgitation postoperatively into that box, and then you divide the rest of them up. It's A over C divided by B over D. So it's not that they're almost 12 times more likely at risk. It's not a logarithmic scale. It just teases out that information, and it's to compare higher odds to not higher odds. And oftentimes these things are additive. So for example, for the GI surgery, and I wanted to mention, so if you have that box and you have 25 dogs in every square and you have 100 dogs total, you're going to have an odds ratio of 1. 1 is neutral. There's no higher risk from that procedure exposure, as opposed to anything greater than 1 technically increases the odds that you will have that outcome, and technically anything less than 1 would be a protective effect. However, it's very important to not overinterpret that data. So an odds ratio of 11.95 is actually quite high. And interestingly, if you tease out the data, 42% of the dogs that had GI surgery developed postoperative regurgitation and vomiting. They may have also had these prior to that. We don't know that these were dogs that were not vomiting. So it's all the dogs that had GI surgery, 42% of them developed postoperative regurgitation and vomiting. So interestingly, if they were not pre-medicated with a strong sedative such as medetomidine or acepromazine, their odds ratio of developing postoperative regurgitation and vomiting. So in this situation, we want to not interpret the data that, oh, well, if I pre-med with ACE, then my patient's less likely to regurg or vomit. That's probably not the case. It probably relates to other factors. It probably relates to their ASA score, probably potentially hypotensive going in, perhaps there was emergency surgery and they didn't need to have a strong sedative. So that's really important when you're interpreting that data. A history of vomiting or regurgitation had a pretty high odds ratio at 5. Emergency surgery had an odds ratio of 4, and then there's the data for the GI surgery. So 6 of the dogs, 6 of the dogs that had GI surgery did also have vomiting and regurgitation. Interestingly, having neurologic surgery was also a risk factor of the odds ratio of 3, and it's been shown previously that hemolaminectomy is associated with postoperative vomiting. Sevoflurane had an odds ratio of 2.78. Again, that doesn't mean don't use sevoflurane. It means, I think it indicates that these patients were probably more hemodynamically unstable, or for whatever reason, they chose to use sevoflurane over another inhaled anesthetic. And then being sexually intact was also a risk factor. Other important things, if you read through the discussion, they tease out a whole lot of different scenarios. So vomiting was more significant if dogs had been given corticosteroids, as opposed to regurgitation was significantly higher in dogs that were receiving propofol. So just by way of conclusion, postoperative regurgitation vomiting is not at all uncommon in dogs receiving non-elective surgeries. The question would be whether antiemetic prophylaxis and perioperative antacids should be considered, which is kind of why we included this topic with our feline proton pump inhibitor topic, because, you know, the more data we have, the more further along we get. At the same time, things do tend to get muddled. So the question would be whether dogs that are having GI surgeries or if they have other risk factors. And then I just threw out, you know, cimetidine may be a good choice. Ranitidine probably would be just as good of a choice because they can be given intravenously and they're reasonably safe. We know they don't act very well at the level of acid production, but they tend to be a bit prokinetic. And we know that people that take those type of products have relief of their acid reflux symptoms very, very quickly after taking them. So there's probably something other than just simply the acid production there that's in play. Interestingly, at our most recent doctors meeting where I work, we talked about this paper and, you know, what it would mean, because I'm concerned that in rounds very, very frequently I hear such and such started regurging. And one of my doctors says, well, I don't want to give anything that might be prokinetic to most of my GI surgeries because I'm dealing with bloats, I'm dealing with foreign bodies, and the last thing I want to do is stimulate motility, at least in the short term. And then obviously in the long term, they sit there and they look and go, okay, now my motility is good after they've kind of gotten the patient in a more stable place. So where we've left it is that we're going to just start tracking and seeing how many patients are, and is our experience similar to this study, and could we potentially change the way that we practice? So I think that is it for this paper, and we're ready to get on to the discussion.
If you ever do a lit search looking for evidence that being fed is actually associated with postoperative regurgitation or vomiting, either in humans or in veterinary patients, it's not there. At least not the last time I looked, which was probably 3 years ago. I don't think that we have a really good, I just don't think we have a really good reason to be fasting animals. And I'm not saying that everyone should go out and stop fasting animals before anesthesia. I'm not looking to like change the way you do your business every day, but it is interesting and that here we have a study that looked, for a veterinary study, this is a large study, you know, looking at quite a lot of dogs and looking at anything. It's very obvious by the things they did find associated with it that they, you know, like, many of them, like, for instance, being sexually intact, there's no way that actually being sexually intact has to do with that. That's got to be something, there's something else that's actually it. So in other words, like, they found associations between things that didn't make a whole lot of sense and yet still didn't find an association between having been fed recently and developing postoperative regurg or vomit. So I think that's something that, you know, speaking about future studies and things that need to be looked at, that's something that I think we should look at, especially when it comes to patients who are diabetic or have other diseases that make fasting difficult. Would be really interesting to find out whether or not we really need to be doing it.
Yeah, I would agree with Jamie. I think the flip side is, too, how long are we fasting them post-op? Because I think there's more and more evidence that early enteral nutrition may help with that. I think that far too often there are some that want to keep those patients snuffing by mouth for an extended period of time, and there's more research, more recently, the study that was done at Michigan State with the septic abdomen, feeding those patients as early as 4 hours post-operatively, and finding that it was just as safe as fasting those patients for 24 hours, I thought was interesting. So I think that, I mean, in our hospital, our surgeons are doing a lot more Serenia pre-op, and based on some of the current literature, although I know that certainly isn't doing for our regurg, they're also very open to adding on a promotility drug of your choice. I think more commonly they're using a metoclopramide CRI in those patients, although, you know, a study that I think just came out in the past year looked at, I want to say Postoperative, although it's not readily available IV. I think they had it compounded for that study, which is interesting. I think that would be something to look at in the future, because regurgitation, I don't know about everybody in the panel right now, but post-op regurgitation is certainly one of the most difficult things to treat and very frustrating, and we see it quite a bit. So it would be really nice to have anything in our back pocket to help with that.
Another thing that I think is interesting that they found was that there was significantly more vomiting found in patients given steroids. The reason that I say this is because you can probably tell from the paper that I did before, steroids are kind of a pet area of interest for me. I have done some looking into clinical signs associated with corticosteroid administration, specifically looking for evidence that corticosteroids are associated with gastroduodenal ulceration in dogs. And the evidence for that also, except for at extremely high doses or in combination with NSAIDs, the evidence that in the patient that does not also have spinal cord disease, the evidence that corticosteroids are associated with gastroduodenal ulceration is very, very weak. There really is not data that suggests that it causes GI ulcers in dogs, given at the doses that we would commonly use in veterinary medicine. So I think it's interesting that there was more vomiting associated with it, but I wonder if they did statistical regression analysis to determine whether it was because of the patient population that received the steroids. In other words, was it actually some other effect that was causing the vomiting in those patients, or was it the steroids specifically? Dr. Zenger, do you know if they did regression analysis on that?
You know, I don't know specifically if they did that or not, but we know that the majority of patients that received corticosteroids were dachshunds that were having hemilaminectomies.
Yeah.
So, You know, I think that it's probably not the steroids in and of themselves, although it might be, you know.
Exactly. It's the thing that raises the question, like, is it really the steroid in effect there, or is it the fact that they have spinal cord disease that's, you know, messing with the autonomic nervous system that's serving the gut? So it's just interesting.